Hi, I'm John Carroll, owner of Cardiac Partners and founder of the CPLINK Cardiovascular Database software system. Cardiac Partners' goal is to engage physicians in the management and operation of cardiac catheterization labs and to empower them to optimize the cardiac cath lab. Let me take a minute and describe to you the cath lab PSA. PSA is an acronym. The medical field is full of acronyms. It stands for Purchase Services Agreement. So what is a cath lab purchase services agreement? A cath lab PSA is a business structure by which the hospital and physicians join together to operate the cardiac catheterization facility. By joining together, the parties achieve the benefits of the dyad management structure. A dyad is a combination of an administrative manager and a physician manager working together for the success of the entity. My first project was in Tucson, Arizona. It was called the Heart Institute of Tucson. And the physician dyad leader was my father. So I became a natural administrative half of the dyad. We had incredible success at that facility. Cardiac cath labs use a wide variety of expensive devices, stents, pacemakers, ICDs. If you can control those costs, you can save incredible amounts of money in your hospital. The American College of Cardiology and the Cleveland Clinic both talk about eliminating variations in practice. What they're really trying to do is measure cost variations from one provider to the next and develop cost as part of a best practice benchmarking. CPLINK has been measuring costs for 30 years and has been using those techniques to save money in the cardiac cath lab. Let me take a couple minutes to hit the highlights of CPLINK. CPLINK receives data every single day from the hemodynamic monitor. We immediately sort and create reports from that information provided to the physicians. In some of our projects, every Monday morning we would send out a typical report saying, here's what happened last week. We've been piloting new projects that include a synchronization with the Chronos time clock system to allow you to compare productivity to paid hours for each employee. We also have been piloting a new web viewer system that allows data to be stripped of all protected health information and be available on any device using a login and password. Another new project involves taking the ACC registry data and bringing it back and tying it to all of our cost reports, so you have access to a broad array of clinical information in addition to the cost information. What you find in hospital situations is that differing people have different needs for data. Sometimes they want to see the big picture, things like the volumes. Was it busier this year versus last year? Sometimes people want to know how a particular service line is doing. Perhaps there was a turnover of physicians, or they recruited new physicians. They want to see if those were good recruits, or if it was an important person that left that they need to go back and backfill. The cath lab PSA and the dyad management model allow physicians to control costs and quality, which is the key to value-based healthcare. What's next for your cath lab?